Hi, everyone. We're so excited that you're joining today's webinar on youth and self-care. While we wait for others to join, we will ask you to please select the language that you would like to hear the webinar in today. We have English, French, and Spanish. If you go to the bottom of your screen on the toolbar, click the interpretations icon, which looks like a globe, and then select your language of choice that you would like to hear this webinar in. We're going to give it another minute or two just to let people trickle in and select their language, and then we will get started. Hi again. Good morning, good afternoon, good evening. For those of you just joining, we're really happy to have you here today at our Self-Care Trailblazer Group webinar on self-care and youth. Before we get started, we're asking you to please select the language that you would like to hear today's webinar in. You go to the bottom of your screen on the toolbar, click the globe icon called Interpretations, and then select the language you'd like to hear. It can be English, French, or Spanish. So please go ahead and do that. All right, I think we can go to the next slide and get started. Thanks. So on behalf of the Self-Care Trailblazer Group and the Advocacy Working Group, I want to warmly welcome everyone to today's webinar on self-care in youth and how young people can shape self-care policy and accountability. My name is Kim Whipke, and I'm one of the members of the leadership team of the Advocacy Working Group. And just wanted to say that this is a really important time to be having this conversation. You know, we're seeing rollback in rights for people. We're seeing climate disasters increasing in crises. And we really need to make sure that young people have every tool available to take care of their health and their well-being, especially those that they can initiate and control themselves. So before we introduce our fantastic moderator for today's session, I did just want to say a few words about the Self-Care Trailblazer Group and what self-care is, because we understand that some of you may be new to this topic today. So we can go to the next slide, please. And I will just say, for those who have just joined, we do have this webinar available in English, French, and Spanish. If you go to the bottom of your toolbar, click the interpretations globe, and then select the language of your choosing. All right, so the Self-Care Trailblazer Group, it's a global coalition that was established in 2018, dedicated to expanding the safe and effective practice of self-care so individuals can better manage their own health. Health outcomes are improved and health systems are better equipped to achieve universal health coverage. This is truly a large movement and a global coalition. We have more than 400 member organizations in more than 80 countries around the world. And we're always looking for more members, whether you're an individual member or a representative of an organization. My colleague Victoria will put a link in the chat where you can go and register to become a member if you're not already. All right, next slide, please. Great. So just a few words about self-care. This is a really nice infographic from the World Health Organization. And the World Health Organization does have a definition of self-care. It's the ability of individuals to promote health, prevent disease, maintain health, and cope with illness or disability with or without the support of a healthcare provider. That last part is really important. And you can see here that we see self-care as being a critical piece of primary health care. It's having the support of a health system and health workers where and when needed, but then also having the skills, the information, the confidence and the ability yourself to then act on that. Next slide, please. And then these are just a few examples of self-care interventions. These focus on sexual and reproductive health, but it gives you an idea of what we mean by self-care. This includes things like, giving yourself a pregnancy test or using an ovulation predictor kit. Self-managing your own medication abortion, taking a sample to test for human papillomavirus, or even self-testing for HIV. There are other forms of self-care that I know we'll touch upon today, whether it's mental health for young people and adolescents, maybe non-communicable diseases, maybe even economic self-care. So we're really looking forward to expanding that definition a bit. All right, next slide, please. Great. So it's truly my pleasure to introduce our moderator for today's webinar, Beatrice Okech. So she's a dynamic youth advocate from Kenya with a genuine commitment to catalyzing positive change. She's currently the Vice Chair of Digital Engagement with the Adolescent and Youth Constituency at the Partnership for Maternal, Newborn, and Child Health. And she is also a consultant with the Torchlight Initiative, excuse me. Bea has focused her career on the intersection of technology, advocacy, campaigning, youth empowerment, and she's been orchestrating initiatives that resonate with the lived experiences of young people and contributing to a more equitable and inclusive future. So we're so pleased that you're our moderator today, Bea, and I'm really happy to turn it over to you now. Thank you so much.
All right. Thank you so much. I think I'll start with next slide, please. But hello, everyone, from wherever you may be, and welcome to today's discussion on advancing self-care for youth. Once again, my name is Beatrice Okech, but I go by B or Bea, and I'm super excited and honored to moderate this important discussion. So as part of today's discussion, we're going to reflect on how far we've come from the 2021 Self-Care Trailblazer Group Community Forum, which I was a part of, where young people from over 10 countries shared their experiences, challenges, and priorities as it relates to self-care. Today, we're going to explore the progress that we've made, the remaining gaps, and what we can do to moving forward to ensure that young people have the resources, agency, and autonomy to care for their well-being. But before we do that, allow me to dive into our history a little bit. So in 2021, I was fortunate to have been part of the SCTG forum, where young people expressed the need to remove barriers preventing them from accessing healthcare and exercising their autonomy. At this event, young people were clear about what they needed to thrive, among them being removing legal restrictions on age of consent for SRHR services. This being essential to foster bodily autonomy and ensuring access to self-care services. Further, they talked about strengthening comprehensive sexuality education by integrating self-care as a core element of curriculums. This would ultimately help young people and equip them with knowledge about their bodies, their health, and how to access care. Further, they talked about making healthcare services youth-friendly, because young people are calling for respectful and non-judgmental interactions with healthcare providers to ensure that their voices are heard and respected. Further, they talked about reimbursing self-care products to reduce financial burdens, making essential healthcare products affordable and accessible under universal health coverage. And finally, they talked about expanding access to digital health solutions by promoting innovative ways for young people to engage with healthcare systems through digital tools and platforms. So as we reflect on those priorities from 2021, it's striking how closely they align with the What Young People Want campaign, formerly the 1.8 billion campaign, which is one of the largest global mobilizations of youth voices on health and a powerful example of youth-driven advocacy and accountability initiatives. And the Agenda for Action for Adolescents, which was launched in 2023 by PMNCH and partners. This agenda, which captures the needs, opinions, and perspectives of over 1.5 million young people from all over the world, highlights 7 key priorities for action. So these priorities have been distilled from expert analysis of over more than 1.5 million responses from adolescents and youth aged 10 to 24, gathering responses from over 90 countries, as well as testimonies shared during global online town hall meetings. The initiative found that the majority of young people surveyed prioritize education, skills, employability, emphasizing a strong desire for job stability, financial security, and independence, in addition to a safe and supportive environment, as well as good health and optimum nutrition. So the agenda defines a path forward for governments in partnership with stakeholders from all sectors to develop and implement policies and programs that deliver on these priorities. It advances the adolescent well-being agenda within the current Sustainable Development Goals and sets the scene for the post-2030 Global Development Agenda, co-developed with and owned by adolescents and youth. These young people have spoken about what they want most for their well-being, and as a community, we must listen to those demands and elevate the issues raised by young people globally. Even more interesting are the overlaps between the action agenda and the asks from the 2021 SCTG Forum. Looking at education and CSE, both of them emphasize education not only as a path to knowledge, but also as a foundation for autonomy. Incorporating self-care education into comprehensive sexuality education ensures that young people are empowered to make informed decisions about their health and their bodies. For health and autonomy, a central theme in both the forum and the agenda for action is the removal of legal and policy barriers that prevent young people from accessing essential SRH services, which reinforces the importance of fostering bodily autonomy through self-care. Adolescent and youth-friendly services. Both initiatives stress the need for non-judgmental, accessible, and respectful healthcare. Young people want health services that meet their needs without stigma or barriers, affordable access. The call to reimburse self-care products aligns with PMNCH's push for universal health coverage policies that include financial support for youth healthcare needs. And finally, digital access is a shared priority, with both initiatives recognizing that the potential of technology to bridge gaps in healthcare access, while also highlighting the challenges young people face, such as high cost, poor internet access, and limited digital skills. So based on that, where are we now? While we've seen some progress, the reality is that many of the barriers young people identified in 2021 still persist. Legal restrictions remain in place in many countries, limiting access to SRH services. Stigma continues to prevent young people from fully engaging in their own healthcare, and digital health tools are still out of reach for many. Further, we must acknowledge the increasing challenges adolescents and youth all over the world are facing in light of climate change and increasing conflict, all of which make it difficult for them to access the healthcare that they need. To that end, we hope that today's webinar serves as a key accountability checkpoint, a moment to reflect on the promises made to young people and to assess our progress. We must ensure that young people remain at the center of decision-making, not as passive beneficiaries, but as active participants in sharing the future. In that spirit, we'll be hearing from amazing speakers today who will share their experiences and expertise on the issue of self-care. But before that, I'd like us to take a quick moment to answer one poll question that is going to shape today's discussion. Over to the tech team, please. So just a quick moment, we'll be taking the poll shortly. And then after that, we'll have our speakers introduce themselves. Okay. As we wait, here it is. Thank you so much. So the question is for English speakers, what do you think youth need to practice self-care? Feel free to answer in whatever language you feel most comfortable in. Thank you. So we'll just take a quick moment for that. Okay. In a moment, we'll start to see your responses. I'm super excited to see what your answers are. So it is more of a survey, not really a poll. So please do share your input. Nah. Okay. As we put in our input, just receiving some updates from the tech team. We will be updating it shortly to a Menti poll, just so that we're able to see everybody's responses. We should be seeing those in a minute, and we'll be able to quickly go through them before we introduce the speakers. So just hold on a quick moment, and thank you for your patience. Also, for those of us who've just joined, kind reminder to use the click onto the interpretation button and pick whatever channel you're most comfortable with in terms of language. So we do have English, French, and Spanish interpretation available. Just also a side note, we have French to Spanish, I believe, interpretation available as well. So just a side note. So feel free to use or jump into whatever channel makes you or you're most comfortable with. Okay. A quick moment. Okay, all right. I think we may need to come back to those responses in a short while. So just allow me to introduce our speakers for the day. Rather, I will be asking them to introduce themselves. And then we'll kick off the discussion. Our most sincere apologies for the slight tech issue that we're experiencing, but we should be able to solve that very, very quickly. So as I ask the speakers to introduce themselves, they will also be answering one very important question, which is why are they passionate about self-care for young people? So I will be, allow me to invite the first speaker. Hi, David Martinez. Kindly introduce yourself.
Hello, everyone. So, hello, my name is David Martinez. My pronouns are he, him. I'm from Spain and also serving as the liaison officer for SRHR issues of the International Federation of Medical Students Association. So, thank you for the invitation and super excited to be here.
David, thank you for introducing yourself. Could you let us know why you're passionate about healthcare?
Yes. So basically, why I'm passionate about self-care. So basically, I think that is a combination between my personal experience and also the experience of my peers. So I'm passionate about self-care for young people because I believe it is an empowering tool that can transform lives. Many young people face stigma and barriers that prevent them from seeking the care they need, leading to long-term health issues. Promoting self-care is not just a health issue, it is a matter of social justice, offering every young person the chance to care for ourselves in a discrimination-free environment. And I think that self-care can empower young people to make informed decisions about our health, positively impacting our self-esteem and overall our well-being. And additionally, I am super motivated by the potential of self-care to foster greater resilience in the face of life challenges, especially in a world where social pressures and expectation can be overwhelming. So yeah, I think that is an overview of my passion about self-care.
All right, thank you so much, David. You talk about social justice is bringing us to a really amazing start. So I'll hand over to Ejir Sharon. Kindly introduce yourself.
Yeah, it's afternoon here in Nigeria. Good morning to those who are in the morning, wherever you are in the world. My name is Ejiro Kotie. I am the Executive Director and founder of the Hope Inspired Foundation for Women and Youth with Disabilities. I also work as a gender and social inclusion specialist. And most importantly, I am a young woman with disability, passionate about promoting the rights of young people with disabilities in various spheres of life. To your question, I am most passionate about self-care because, first of all, self-care provides a holistic approach, right? Addressing issues of emotional, mental, physical well-being. And that holistic approach, holistic well-being enables young people, particularly young people with disabilities, to be present in various aspects of their lives and explore, other alternatives in ensuring that they're able to stay in good health. I like one of the definitions that Kim gave earlier on, that it goes beyond, accessing healthcare, but also looking at other approaches, other systems, right, that young people can use in maintaining their well-being, their overall well-being. So that in itself is a driving passion for me when it comes to self-care for young people, particularly young people with disabilities. Thank you.
All right, thank you so much, Sharon. I'll hand over the mic very quickly to Tasfia.
I hope I'm audible. So, hello everyone, I'm Tashrita Anandridita. I am from Bangladesh. I'm a young activist here working for gender rights and SRHR. I work in an organization called Transcend that works for the gender diverse community in our country as a marketing director, and I'm also a member of IPPF South Asia Region Youth Network. Thank you, and so glad to be here. So, and to answer your question, why am I passionate about self-care? I think self-care empowers me and young people to have the control to their health, to our well-being, and to our future. And it's not just about self-care or survival. It's about reclaiming the autonomy and thriving in a society that often overlooks their needs. And I believe I am passionate because I believe self-care is a vital tool for building confidence, resilience, and advocacy that helps young people to shape their own paths, leading fulfilling and stigma-free lives. So yeah, that's why I think I'm very, very passionate about self-care. Thank you.
All right, thank you so much, Tasfia. I'll hand over the mic now to Esther, our final speaker, and then we'll move to the next section of the webinar. Over to you, Esther.
Gracias. Buen día. Yo soy Esther Girón, soy
Hello, I'm
abogada
Esther
y
Girón, lawyer
fundadora de un colectivo
and
de personas
co-founder
minoritarias que se llama
of a
TELAR, que trabaja por
community-based
la
collective
autonomía
that works
con
towards
una
autonomy
comunidad
and
de República Dominicana, ubicada en el norte de República Dominicana. Y bueno, construyo procesos comunitarios por la autonomía y por la defensa del territorio, el agua y la vida. Y como caribeña, pienso que no puedo hablar de autocuidado, de autonomía corporal, sin mencionar que habito un territorio que está atravesado, ¿no?, por procesos que son coloniales. Y por esto esta pregunta me toca, porque el autocuidado tiene un enfoque integral que tiene que ver con el entorno en donde viven las personas y sus necesidades y deseos individuales a lo largo del curso de vida. Y
Et
esto es un
on s'intéresse à
enfoque
l'environnement dans lequel vivent les
que es
personnes et
holístico,
les expériences très
que
intéressantes de leur
tiene que
vie.
ver
C'est vraiment
también
un
con
focus
garantizar los
très
ambientes
général
seguros y favorables para garantizar las
et ça permet
intervenciones.
aussi de
El
garantir un
Caribe, como
environnement
sabemos, es el
sécurisé
centro de la emergencia climática
pour des
global y
interventions
capitalista que
positives.
causa el
Comme
norte
on le
y que
sait,
casi siempre se
The
paga en el sur
climate
global,
emergency
donde cada
caused
vez se
by
sienten más las
capitalism,
tormentas, las
which comes from the
sequías,
north, but
los
that affects
huracanes,
mostly
hay
the global
precarización de
south,
ese
and we
lugar y cada
suffer
vez más inseguridad
hurricanes,
alimentaria.
rains,
Yo creo
and
que
more food
el enfoque del
and
autocuidado
safety.
se debe
So
hacer siempre,
we
¿no?
should
Desde
focus on
las
self-care
necesidades
always
inmediatas
based
y
on
poniendo
the
siempre en el
immediate
centro a la
needs
gente que está en menor
and
escala de
on
privilegios. Y
people who are
también el autocuidado pasa por
the
justicia
least
social, como
privileged, and
mencionaba un
also has to
compañero,
do with
por la
social
justicia
justice,
reproductiva.
as our
La
colleague
justicia
said, and
reproductiva es
reproductive
un concepto
justice.
parido por los movimientos
Reproductive
feministas negros
justice
y siempre va más
was a
allá solamente de
concept
normal por
that
referencia
came
a la
out
igualdad de
from
género, tiene que
Black
ver también en
feminist
las intersecciones de
communities,
clase
and
y de
it
raza.
goes
Entonces,
not
por
only
eso creo
not
que
only has to do with equal gender,
el
but also
autocuidado tiene que
with
tener en cuenta, ¿no? Estas
a fight
múltiples formas
against
en que las
colonialism. So
instituciones y las
self-care
normas
has to
culturales y los
do
sistemas de
with
opresión se
fighting oppression
eslabonan y
systems
ejercen control y reproducen
that
violencia sobre las
control
personas jóvenes y sus
people
opciones
through
reproductivas y sexuales.
violence. And I'm talking about
Gracias.
young people, and they also control reproductive, young people reproductive rights. Thank you.
All right, thank you so much. I really appreciate Esther's interjection and her input, especially around using self-care as a key, tool to dismantle the patriarchy. That is really exciting for me as an intersectional feminist, and I am really excited to hear and just moderate this discussion. As you can tell, we have some really incredible young people on the panel today, and on that note, I am excited and thrilled to kick off the panel discussion officially. But just before I do that, I would like to encourage us to use the chat function. If you have any questions, if something that one of our speakers says, inspires a question, feel free to use the chat function, and we will be addressing any queries that you may have at the tail end of this webinar. So to kick off our discussion for today, I'll be starting off with Sharon. And the first question. So we've mentioned that one benefit of self-care is that it can give young people an opportunity to access healthcare without stigma and discrimination. In what ways do you think self-care can meet the needs of youth with disabilities, and where do we need to be mindful about adapting self-care approaches for this group? Over to you, Sharon.
Okay, thank you so much.
Hello, Sharon. Can you hear us? I think you might be on mute.
Can you hear me?
Yes, we can hear you now. Wonderful.
And thank you for that. Thank you for that question. As I said earlier on, because of the importance of self-care, particularly in relation to that holistic well-being, particularly for young people and young people with disabilities, given the peculiarities that comes with disabilities, the care agenda is at the heart of disability, because at various levels of the life of a young person with disability, the concept of care applies. And now narrowing it down to the individual, one of the key benefits that I think that the self-care approach provides for young people is giving them that autonomy. I think one of the speakers in her introduction talked about that autonomy, where young people, particularly those with disabilities, have the agency, the independence to be able to make and take decisions that protects them, right? That they can use in caring for themselves. Additionally, some of the self-care interventions, like you have mindfulness, you have yoga, you have meditation, and all of the other self-care interventions that exist also provides avenues for persons with young people with disabilities, to be able to attain emotional stability, because very closely attached to disability are issues of trauma, are issues of anxiety, issues of discrimination and stigma, and where there are other, strategies and tools that these young people can use in addressing these issues. So in terms of applying this meditation or mindfulness and so on, then that also provides a means for them to be able to attain stability and wholeness. Additionally, promoting self-care, that's additionally, you have social connections where, because self-care, just like you have the SCTG, where you have safe spaces, those safe spaces also provide, avenues for young people to build communities, and then for also young people with disabilities to also be able to engage in such communities, and their issues, key issues that affect them, are addressed, collectively. So in terms of strategies or approaches for adaptation, I think that one of the key gaps that we have is issues of accessibility. Take, for instance, we have various translations ongoing on this call. And assuming you have a deaf participant on this call, they may not be able to fully participate because we've not really been able to provide accessibility for them to be able to engage in, information or conversations around self-care. So I think that one of the key adaptations that, the self-care movement and organizations and activists working in this space need to be mindful of is that accessibility, ensuring that youth in their diversity, including youth with disabilities, are able to actively engage in self-care spaces, and then for physical activities and all that, there's not just, there's also accessibility in physical spaces where meetings and conferences on things on self-care are being done. And that is closely related to communication as well. So for as much information that we have around self-care, we are ensuring that the various communication channels that this self-care information are being sent out also addresses the needs of peculiar groups. The cultural sensitivity is equally very important, because as we know, there are different, young people come from various cultures. Somebody talked about patriarchy. In Nigeria, patriarchy is a major issue. And we want to look at how do we use, some of these self-care approaches to dismantle the negative implications of patriarchy and all of the other structures that limits, full expressions of young people, particularly young people with disabilities. Additionally, is to also look at trauma-informed strategies. Be mindful of that, because as I said earlier on, when it comes to people with disabilities, some persons with disabilities have gone through various forms of trauma, and we have to also be mindful that some of the environments that we create do not trigger, further trigger the traumas that some of these persons with disabilities or young people
Personnes
with
en situation de
disabilities
handicap ne créent pas de
have
traumatisme
experienced. So I will
supplémentaire.
conclude by
en un
saying
trauma
that
o han sufrido un trauma.
for us to be able
Así
to
que
have an inclusive self-care movement, we must also make sure that we are mindful of intersectionality, because now we talk about young people, but we are also looking at young people with disabilities. We're also looking at young people from low-income communities, young people from various parts of the globe, those in the global south, and first world countries, and so on and so forth. And then also, are they paying attention to the peculiar needs of these young people across the group, and not just applying a one-size-fits-all approach. So I think I'm just going to end here so that I can also create room for other speakers to contribute. Thank you.
Thank you so much, Sharon. You've, given us a lot to think about, definitely, and shared, some incredible experiences. I particularly appreciate what you've talked about with intersectionality and ensuring that no one is left behind, especially young people living with disabilities. You've also talked about safe spaces, which is really awesome, and fortunately ties into my next question to Tasfia. Could you please tell us about the environment for sexual and reproductive health care, self-care, and young people in Bangladesh? What are the challenges? Where is progress being made? Over to you.
Thank you so much for your question. So, to start, I would say South Asia's healthcare landscape has seen improvements in recent years, but gap exists, and especially for the marginalized community. And as I said before, SRHR is not about just healthcare; it's about dignity, empowerment, and inclusion, right? So, to talk about the current environment and to give all of you a small preview of what's happening in my country for SRHR or self-care, I think if you all know about the menstrual regulation, which is known as MR policy. So this policy gives women to abort the child, abort the unwanted pregnancy, even though abortion remains restrictive, except to save a woman's life, which restricts bodily autonomy of a woman. So I would say definitely the progress has been made through policies such as MR, but why do we have to go with another name? Why just we cannot tell this? Why just we cannot claim our bodily autonomy with the name we want to address? And then public health services are expanding, of course, but inexclusivity for marginalized communities still a challenge. As a youth who advocate for LGBTQIA rights in Bangladesh, Muslim majority country, we often see religious opposition, which is one of the main barriers for this marginalized communities' right. And for this stigma, the LGBTQIA community, the trans community often face barriers in accessing SRHR rights due to the social taboo, the lack of gender sensitive care, etc. And then if we talk about as I was talking about the abortion right and MR, so even if we can abort with the name of MR, there is a lack of method of preference. There are systemic shortcomings. So I think to answer your question about the current environment, these are some points I wanted to talk about. And then you asked about the progress. I think I've also mentioned what progresses are currently my country is making. If I may conclude my points, I just wanted to add that social media activism and youth participation in policy consultation are on the rise. Yes, I would not deny it. But it's often tokenism, right? The NGOs here operate, but it's mostly for the tokenism and everything. It doesn't have any realistic approach most of the time, or it doesn't have actual solution to the problem. So yeah, so I think these were my answers to your question.
Thank you Tasfia, and thank you for sharing your perspectives from Bangladesh, which interestingly enough are some of the challenges that many of us are facing in many of our countries. When you talk about tokenism and how do we shift that to actual, proper meaningful youth engagement, where young people are viewed as equal partners and they have, equal stake in shaping what healthcare looks like, what sexual and reproductive healthcare looks like, what self-care looks like, right? So thank you so much for sharing that. And we'll be hearing shortly from Esther. But before I pose the question to Esther, just a kind reminder, please pose your questions in the Q&A box, not the chat box. Apologies from me for that. If you had put your question in the chat box, please feel free to also transfer it to the Q&A box just so that we're able to manage your questions properly. So yeah, thank you so much. So over to Esther. How does the concept of self-care resonate in the Dominican Republic? What are some examples of how young people in the Dominican Republic practice self-care? Where do young people face obstacles in caring for themselves and their families, e.g. abortion, self-managed abortion, contraceptives, HIV, etc.? Over to you, Esther.
Gracias por la pregunta.
Thank you for your question.
En República Dominicana,
In
a
the
pesar de
Dominican
que el marco
Republic,
legal
in spite
vigente
of the fact
reconoce y
that
garantiza el
the
derecho a la
law
salud, a los
acknowledges and
servicios de salud
guarantees
sexual y
health
reproductiva y
rights
acceder a
and
métodos
reproductive
anticonceptivos
health
modernos, en
rights,
realidad
and
en
there
la
is
práctica esto
modern
no
anti
se ejecuta.
birth
Los
measure
programas de atención a
systems
la
or
salud
measures,
sexual
but it
integral
is
de
not
los adolescentes ni
applied in
siquiera cuentan
reality.
con una relación presupuestaria
Young
específica
and
destinada a la
adolescent
población joven, sumado a
populations don't
otros
have access
aspectos que
to
también
these
agravan el
care.
acceso de los
And
jóvenes a
there's
servicios de
also
salud
another
privado y
aspect that
especialmente a la
prevents young
salud
people to access
integral.
self-care, especially
Una de las cuestiones es que
integral
tenemos un
health.
sistema de salud
One question is
privatizado
that
y República
health
Dominicana es
system
uno de
is
los
private,
países que menos
and
invierte en
the
salud en la
Dominican
región
Republic
latinoamericana.
is
El
one of
gasto
the
público
countries
en
that
salud
least
en República
invest in
Dominicana en el
health
2023 fue de
in
apenas el
our environment.
2.7 del
It's
PIB. Es el segundo más bajo
1.7%
de
of the
Latinoamérica
GDP. So
después de
it's the second
Guatemala.
lowest
Además de que en República
investment in
Dominicana
health, in
tenemos un modelo de
public health
prohibición
system,
absoluta
lower
del
than
aborto, es
Guatemala.
decir, que el
And
aborto es
so
ilegal en todas las
abortion is
circunstancias,
illegal in
incluso
any
cuando el embarazo
circumstance,
supone un riesgo
even
para la
when
vida y la gestión
pregnancy
viable.
is a threat for
Esta
the mother's
prohibición
health.
está
This
vigente desde
provision exists
1944
since
y
1844.
bueno,
So,
se prevén penas en el Código Penal hasta de 2
and
años
the
para las
legal
personas que
system
se practiquen abortos y 20 años para los profesionales
has a
que
clause of
presten el
2 years
otra cosa,
of
otro aspecto
imprisonment
que agrava
for
también el panorama
the
en República
doctors
Dominicana es
who
que no existe un
abort.
marco normativo que
And
garantice la educación
the
sexual integral
Dominican
en las
Republic
escuelas.
has
Y en
no
el
framework to
2022 hubo un
teach
retroceso de la
self-care,
única
self
ordenanza que
health
había en el
care
Ministerio de
in
Educación
schools.
que
The
declaraba como
Ministry of
prioridad la
Education
política de
declared as a
educación
priority
en equidad
the
que
education
había en
in
el
health,
país.
in
Y
self-care,
también fue derogada de los
but
planes
it was
universitarios, de
changed
los
as
programas
well
y
as
estrategias pedagógicas y de
university
todo tipo de actividad
plans.
administrativa a nivel
So
del Estado. Entonces, esto implicó un
the
gran
state
retroceso
has now no
para la educación sexual en
sexual
en las escuelas.
education in school
Además,
and
República
university.
Dominicana, la
And
tasa
the
de mortalidad
Dominican
materna
Republic has a very high
es exponencial.
maternal
En
death rate
2021 ascendía
in
a 669
2021,
por cada 100.000 nacidos vivos. Además de que este es uno de los
189
países
for
donde más partos forzados
100,000
se practican.
born
Racismo
babies.
estructural
And this is
también
where more
es
cesareans are
exponencial en
practiced.
República
Also,
Dominicana. Las
there's
mujeres negras
structural
racializadas de sectores
racism. So,
populares y de
Black
barrios corren más
women
riesgos de morir
from
durante los partos
the
porque no reciben atención
poor
adecuada
neighborhoods
durante
are
los
the ones
embarazos y
who
también pues
have
tienen más
more
riesgos de morir
uh,
en
uh,
casos de aborto en
possibility
países
to
como la base de
die
salud
while
raquítico
giving
como
birth
es
or
el que
while
tenemos
having
en
an
República
abortion.
Dominicana.
as it is illegal in the Dominican Republic. In spite of this, there are community experiences where organizations are progressing towards body autonomy, as in the case of my organization, the organization that I founded. We present self-care as a part of body autonomy, and we also want to look at it as a structural issue, issues that women from poor neighborhoods face. And I'm talking about sexism, racism, and in 2022, we developed the first book for integral sexual education for young women and women in the Dominican Republic. Young girls get pregnant accidentally between 15 and 19. 20% of them get pregnant. So we're thinking about especially young women in rural areas. So we taught them for free about sexual reproduction. And this book has 6 chapters: consent, the female cycle, and anticonceptives. And the last chapter has to do with sexual diseases. And this was supported by the Ministry of Education. It wasn't easy, but we succeeded to convince a few people and to teach several schools. This was a great achievement. Thank you, and I'm open to any other question you have.
All right. Thank you so much, Esther, for sharing your insights. So we are running a little bit behind, so I'll try and make things a little bit faster. So over to David. You are both a young person and a future medical provider. Can you say more about what you think are the biggest self-care needs, especially among young men, and adolescent boys, from a personal and provider perspective?
Yes, thank you for the question. So I think that if I start to point and to list like all the needs that we need related to self-care, I think that I can spend the whole afternoon. So that's not the point. So I think that I'm going to highlight the biggest one. So I think that the first thing to point out is that we don't really know what self-care is. No one talks about it. And we are not aware of its importance or the implications. And also it has not only for our health, but for all the areas of our lives. Therefore, the first need that I think that is important to highlight is the visibility of self-care. So from my personal experience, one of the biggest self-care needs among young men is the space to talk about our emotion and also about our vulnerabilities. Often societal norms around masculinity can be restrictive, making it difficult for many young men to express their feelings or seek help when they need. That this can result in higher risk of mental health issues such as depression and anxiety. Additionally, in my personal experience as a LGBT man, the stigma surrounding my sexual orientation and also my gender identity can significantly impact of our self-care practice, particularly regarding sexual health and the prevention, for example, of sexually transmitted infections. So the fear of discrimination or judgment can prevent us from seeking essential healthcare service, including, for example, testing and treatment for STIs. This stigma also can create like barriers to open conversation about sexual health, leading to misinformation and a lack of awareness about health. But also combining my personal experience also with the experience as a future healthcare provider, I recognize the critical importance of addressing these barriers in the healthcare system. We must prioritize integrating programs that not only promote mental and emotional health, but also provide like comprehensive sexual health education that reflects the the realities faced by young men, especially those from vulnerable populations. So this approach will encompass the promotion of healthy relationship, respect for diversity, equity, diversity and inclusion, and a holistic understanding of self-care that also includes mental well-being alongside physical health. So I think that by fostering an environment where young men can openly discuss our feelings and seek help without fear of judgment, we can significantly improve their overall well-being and health outcomes. So I think that the biggest need is right now is to create a safe space for dialogues and education. I think that both of them are essential in eliminating the stigmas that also to create and also to promote effective self-care and ultimately to contribute to have healthier lives. Thank you.
Thank you so much, David. It's incredible to hear from a future healthcare practitioner, and it is definitely exciting to see such conversations happening right now, and will definitely, shape what healthcare looks like and what self-care looks like in the future. So I'll go back to Sharon to share with us some perspectives from Nigeria. Nigeria is a frontrunner country in developing and rolling out national self-care guidelines. So how can youth, including youth with disabilities, inform and influence the implementation of the guidelines and ensure accountability to the needs of young people? Over to you, Sharon.
Thank you so much. It has been an engaging and enlightening session. I think in terms of implementing the national self-care strategy or guidelines, youth, particularly those with disabilities, actually can play a vital role in terms of informing and influencing the implementation of this. And there are just a few strategies that we can look at, in terms of ensuring that young people play that critical role. And one of such ways is actually, creating advisory roles, engaging young people in decision-making, right, as it relates to self-care, whereby they can suggest strategies that works for them. They can be part of the planning, self-care planning, and then strategies that addresses their peculiar needs can be adopted. The other thing around implementing these guidelines is capacity building, right? We need young people with disabilities or young advocates who are trained on self-care, policy analysis, advocacy. David just talked about some challenges which are very real, and where we don't have trained young advocates or young people with disabilities who are skilled in advocacy, who are skilled in policy analysis as it relates to self-care, then the implementation of these self-care guidelines remains, it just remains guidelines that are just there that are not implemented. So we must really channel resources and channel efforts into ensuring that the capacity of young people are built, to be able to carry out adequate advocacy. There's certainly the need for public enlightenment of young people. Just again, that we talked about the lack of awareness. A lot of young people don't even know what self-care is about. They probably would never have heard of the concept of self-care. So we must use technological channels, social media particularly, which is where a lot of young people are very active on. We must leverage these various social media platforms, to be able to push out information about self-care, what it is about, how it applies to various aspects of their lives, and how they can actively participate, in implementing such national self-care guidelines. That's a very important one. Of course, I like a fora as this because it brings various youth groups, young people together, and we are able to create existing partnerships, in advancing rights of young people as it relates to self-care, in contributing to the empowerment of young people, particularly young people with disabilities. as it relates to self-care. So we must also, enhance collaboration platforms. The SCTG is one. We must encourage more members, more young people, more young youth groups to be part of this, because together, as they say, we can work together to leave no one behind. In terms of influencing implementation as well, I think a key part of that as well is budgetary provisions and budgetary tracking. There must, state governments or nationals, if we must have effective implementation of whatever national self-care guidelines that are in place, there has to be budgetary allocations for such programs to be effective, and then young people also have to be able to track, these allocations that are being made, if they are made at all. Young people have to be able to track track those allocations and track the implementation. And then we're also able to activate effective monitoring and evaluation processes in place to be able to, measure how impactful are this implementation of self-care guidelines for young people, what are the gaps, what needs to be improved upon, and then how do we make progress forward. And with all of these feedbacks in place, we're able to develop policy briefs that can be used again to engage with duty bearers for more responsiveness, either budgetary responsiveness or political will in terms of implementing these guidelines. And young people can actually lead these processes, holding their governments and holding duty bearers accountable. And I believe that with forums like organizing annual youth forums as well, where young people can review progress, address concerns like what we are doing presently, we can also make some progress when it comes to implementing these guidelines. And for persons with disabilities, I hammered heavily on accessibility. We must focus on that and ensuring that even in groups that are being established, you have representation of young people and other, young people in their diversity. And if we're able to, put all of this in place, regular audits of our self-care systems, self-care approaches, making sure that they are inclusive, I believe that by implementing all of these various strategies, Nigerians, including youth with disabilities, can ensure that including youth and those with disabilities are meaningfully involved, and then that results to inclusiveness in self-care and empowerment for young people in general. So thank you.
Thank you so much, Sharon. Interesting to hear concepts around investment and resourcing for healthcare and how self-care could be an interesting solution to maybe solving or closing some gaps around resourcing for healthcare, and also, as always, not leaving anyone behind. Thank you so much for that. I'll also hand the mic over back to Tasvia, just to talk about, just to dive further into her work on advocacy work on health and the well-being of LGBTQ youth. So Tasvia, what would you say are the biggest demands regarding self-care for this key group that you work with? And then are youth at the decision-making table when it comes to health, gender, and related policies in Bangladesh? And finally, how do you think youth perspectives can be amplified to shape self-care and healthcare policies in Bangladesh?
Okay, so thank you for your question again, and I'll answer your question one by one. So, in order to address the demands of the LGBTQIA community, we need to address the challenges they face, right? So the challenge, stigma and discrimination always, where they get hesitation to seek care due to the fear of judgment or violence. The inadequate healthcare facilities, economic barrier, lack of safe spaces, and currently there has been a massive uprising anti-LGBTQIA backlash going on in my country. So these are the few of the challenges that they're facing, and of course there are more. So I would say the demand, after working with them closely, I would say their demand is first and foremost mental health support, safe spaces to express themselves and address identity struggles. Then would be the sexual health resources. They need inclusive education on safe sex, HIV prevention, and reproductive health. And they need their dignity and autonomy in healthcare, where all youth individuals, including LGBTQI youth, demand respectful treatment from service providers. I think one of the main demands are to include CSE that include information that addresses their unique experiences, and as I talked about it already, safe environment. Since I already mentioned, there is a massive uprising of extremism going on in my country. The safe environment, the need of safe environment is now very, very important. So these are there are few of their top demands I talked about. So then your question was if I am in the decision-making table. So you as a youth, as a very young activist, being in the policy-making table decision is little bit tricky. Youth involvement is policy making is still limited in Bangladesh. So since I have been working with in this field for last 4 years, 5 years almost. So I had the opportunity to take some of our to talk about some of our problems, the problems that this community is facing, to the policymaking table. Yes, of course, but not often. As I said, youth perspectives are often heard but not taken seriously, especially when it comes from the gender diverse youth. I think they still need more representation. And your another question was how to amplify youth perspective. So I think to institutionalize youth participation in policy dialogue, as I say, that's still very tricky. And then we should focus more on capacity building, where we equip young advocates with skills to engage in policy discussion effectively. Then we should include more mentorship programs where we foster intergenerational conversation between youth and policymakers. And lastly, I would say formalize youth-led movements in healthcare frameworks to ensure a sustainable impact. So, and yeah, this would be some of the things I would say that how we should amplify youth perspective in policymaking table. Then to answer your last question, which you asked as what's our top demand to decision makers, I'd like to go point by point. So firstly, inclusive youth-centered healthcare that recognizes diversity. Then a stigma-free environment for SRHR services, mental health care, and gender-affirming healthcare. CSE sessions on self-care that can include fertility regulation, sexual health promotion, where we can seek information and advices on STI, HIV, etc., and more discussion on how to prevent the disease and how to control it, and what are the treatments. So, and yeah, this would be, I think, some of our top demands. Yeah, so thank you for your question. So this would be my answer. Thanks.
All right. Thank you so much, Tasfia. One of the best things about having such discussions is how you realize that while we are so different, we are also very similar in some of the challenges that we face, and we can benefit a lot from each other based on, some of the input that we're receiving from the young people on this panel. We have insights from Nigeria, we had Bangladesh, Dominican Republic, Spain. So it's really exciting, and it really is incredible to be able to hear such perspectives further, around what youth-led social accountability looks like and how young people, are leading the charge in terms of advocacy and really using the tools of our time, technology, social media to really drive the agenda. So on the same, sort of tangent, I'll invite Esther to speak to, the work that's happening in DR as well. So Esther, how are youth organizing or mobilizing amongst themselves or across the board to create a more favorable legal and policy environment for sexual and reproductive health and self-care in your country? And what tools and resources or partnerships from this larger community could be useful in pushing for change and holding leaders accountable? Over to you, Esther.
Gracias por la pregunta. Bueno,
Thank you for your question. In my context, it's quite specific for what I mentioned previously. I think that there is young women who are Afro-feminist and who come from poor backgrounds are putting pressure so that we reinforce a community for self-management and self-care. And I think this is a priority. We want to strengthen the community in order to also transform people's minds. And from our organizations, I think we can construct and build a community through people's education in order to fight fundamentalism. I think that we need to depenalize sexuality, to fight dogmatic positions that only want to leave sexuality in the private sphere with a guilt complex. We need to bring these back to a focus of pleasure and freedom. And we have quite repressive policies that is guided by church and religious fundamentalism. And this has an effect on administrative and judicial policies. I think that the Dominican state should be more active in constructive society so that there's a greater social justice. And I think that reproductive and sexual rights is a part of social justice. So we need to have sexual education at school so that, and this should be based on understanding the scientific aspect of it. I think that within, if we include sexual education, we will reduce teenage pregnancies, especially in more vulnerable neighborhoods and communities. Also, we need to have to reduce the rate of young women who are pregnant at a too young age. And for this, we need birth control systems. We have a lot of birth control devices, and we need for that better health system. We should, above all, invest more and better in public whole sex health and also mental health, as my colleague said here. I think that we need to help individuals exercise their health rights and their sexual and reproductive health rights. And I think it has a lot to do with racism and colonialism. We see how healthcare systems that are privatized are making the rest of the population more vulnerable. And therefore, the healthcare system should guarantee rights so that any individual may have a health system available no matter how much they make. I don't know if you have any more questions for me.
Not at present, Esther. Thank you so much for your input. We'll very quickly go over to David once more. David, how can medical providers advocate for stronger youth-friendly self-care policies and practices within their profession and with their governments? And what are some of the ways that you are currently advocating for this now at the IFMSA?
Okay, thank you for the question. So I would like to say, first of all, that medical providers play a crucial role in advocating for more effective youth-friendly self-care policies by actively collaborating with youth organizations such as IFMSA and also the community. First of all, I would like to say that by listening our needs and our experience, as young people, they can advocate for more inclusive and tailored health service. But also, when we are trying to talk and we are discussing about how to involve youth people and how to collaborate with different youth organizations, I would like to highlight the word mindful youth engagement. That we would like to be involved like in all the process, in all the step of the process to, for example, to design and implement a service. So just to point and to list out like the different things that, for example, healthcare providers can do as like, for example, education and awareness, collaboration with youth organization, be involved in the policy making and in the have participation in the policy process, development of youth-friendly programs and research and evidence. However, to connect the first question with the second one, it's like super important to recognize that training of healthcare professional often begins in the medical school, where self-care is not addressed at all. This gap in education can limit providers' ability to understand and promote self-care effectively among young people. So I think that by incorporating self-care principles into the medical curricula, future healthcare professionals can be better equipped to support and advocate for the self-care needs of youth, ensuring a more holistic approach to their health and well-being. So as the International Federation of Medical Students Association, we advocate for youth-friendly self-care policies throughout very different initiatives. So, for example, with our members, we develop like different youth-centered workshops. We conduct different workshop and capacity building initiatives, not just in health as a whole, but also how to advocate for health and how to be more engaged in this kind of process. Like, for example, to advocate for self-care policies. And at some advocacy campaigns, we raise awareness about self-care through social media and partnership, aiming to reach a wider audience. Also, we try to be super involved in the policy development and to have engagement with different stakeholders. For example, we foster dialogues with health professionals and with policymakers to ensure that our voices as youth are integral to the decision making. Also, we are developing like different research efforts to assess like the barriers and also how the self-care is addressed in the medical school. So with that, we can try to develop like something like, for example, different decalogues and some recommendation for the medical schools and for the governments. And for example, at the global level and also at the regional level, we act on behalf of the IFMSA at different conferences, and not just conferences, for example, of the United Nations, but other levels of conferences are in best practice and advocating for youth-friendly self-care policies. Thank you.
All right. Thank you so much, David. That was incredibly incredible to hear. Just the work that you and your partners are doing to shift what healthcare looks like in the future and starting, at the very nascent level, which is education for healthcare providers. So that's really exciting. Also, just a quick thank you and a quick shout out to the speakers of the day. Thank you so much for sharing your incredible insights. And then thank you to our participants for the day who've, been having really engaging discussions in the chat and, have posed a couple of interesting questions. And so that is what we will be covering now. We do have some amazing questions from the participants, and I'll start off with the first one, which is around adolescent and youth advisory committees. So I will welcome all of the panelists to speak to this question, being, do any panelists have experience with adolescent and youth advisory committees as components or structures to involve young people in higher levels of programming? And can you share any other best practices to ensure good adult-youth synergy? Would like to start to the panelists? Okay, over to you, David.
Okay, so per sort. First of all, I would like to say that try to be in contact with youth organization and try to be in contact with the different communities, because when we try to be engaged in different, like for example, policy development, and for example, to be more involved in the decision-making process, for us is super difficult because we face like specific challenges. For example, the first one can be like the financial challenge, for example, to attend like different meetings, like for example, because most of the meetings, for example, there are like in United States of America. So for us, it's like super difficult. Also, for example, we face visa issues and different issues related just for the travel and, for example, the accommodation. But also when you are, for example, drafting something, or you are trying to incorporate, or you are trying to develop something related to youth, also not just to ensure that the needs of youth are included in that document, also involve the youth in the drafting process, involve the youth in the implementation process, and also in the evaluation process. Because when we are trying to be more engaged, a lot of organizations and governments and different decision makers, they say, okay, what do you need? But when we are trying to be engaged in the development and also in the implementation and also in the evaluation, this is one of the biggest challenges that we face. So yeah, this is my recommendation on how to involve adolescents.
All right. Thank you so much, David. Esther, we do have an amazing question here for you from Mozambique, where voluntary termination of pregnancy or safe abortions became legal in 2014. However, as in many countries, adult consent is required for adolescents below the age of 16. In several focus group discussions that our participant was in with adolescents below the age of 16, adult witness consent was pointed out as an important restriction for their access to safe abortion care. Being so, self-management of abortion is also restricted. The participant would like to hear from the panelists about how self-care could improve access to safe abortion for this group, in the context that although safe abortion is legal, there are also legal restrictions to teens, increasing their vulnerability and risk of continuing to undergo unsafe abortions. Over to you, Esther.
Hola, perdón, ¿me podrían
Hello,
repetir esa
I'm
pregunta?
sorry. Could you please repeat the question?
Okay, so the question is around access to safe abortion care. So in this case, in Mozambique, voluntary termination of pregnancy or safe abortions became legal in 2014. However, there is need for adult consent for adolescents aged below 16 years old. And based on focus group discussions that the participant had with adolescents below the age of 16, the need for adult witness consent was pointed out as a huge restriction to their access to safe abortions. And also to note, self-management of abortion is also restricted for this age group in Mozambique as well. So the question is, how do you think self-care would improve access to safe abortions for this group of adolescents under the age of 16? Whereas safe abortion is legal, but the age restrictions make it difficult for them to access abortion. And a key hindrance would be, or a key challenge would be young people undergoing unsafe abortions based on these legal restrictions.
Bueno, si entendí bien la pregunta es,
Well, if I've understood your question, you're asking how we can guarantee the consent of people under 16 so that they may carry out their a safe abortion, right? Is that so?
The question is
bueno,
rather,
trataré de
how do you
responder.
think self-care could be a solution to cater to this age group and to cater to the legal restrictions?
De acuerdo.
Okay,
De acuerdo, bueno,
got it.
desde
Well,
colectivos en República Dominicana que estamos
in the
trabajando
Dominican
en
Republic,
autogestión, para
several organizations
nosotras
like mine are
es
working on
importante que el
self-care
derecho a decidir de la
and
persona que está embarazada
the
prevalezca.
right for a person
En
pregnant
muchos
should
casos que
be stronger than
acuden
any other right.
a
So
tener
if someone
a preguntar por información sobre el acceso
comes to
a
get
el aborto,
information
preguntamos por
on
los
abortion,
padres.
we ask them
Pero en
about their
casos en
parents. But
que los
in the
padres no
cases where
están,
parents aren't
entonces sí
there,
tenemos que hablar
then
con personas que
we need
estén
to
en el
speak
servicio de
with
salud y que sean
people
aliadas.
who are in a
Porque
healthcare
nosotras
system,
pensamos
because we
que
think that
no debe existir estas barreras basadas
there
en
shouldn't be any obstacle
el paternalismo y también el
based on
infantilismo. Yo creo que las personas
paternalism
jóvenes tienen derecho a
and
decidir sobre su cuerpo también
infantilism. I
en
think
esta
that
hora.
young people should
Entonces,
be able to decide for
nosotras
themselves, for
como
their
personas que
body,
damos
and
información
we hand
en
out
redes
information
de
to
acompañamiento en aborto seguro y
support
autogestión,
networks for
siempre nos
safe
cercioramos de que estas
abortion and
personas puedan acceder,
self-care.
aunque no
And we always
lo
make
hagamos
sure that
nosotras
these
mismas,
people
sino
access
buscando información y también a
this
través de
possibility,
canales,
even though we don't carry out
de
the abortion
canales de
ourselves, we
acceso
make sure that they
en
are in
lugares
contact with channels
hospitalarios
in
que
with
puedan
hospitals that may
ayudarles.
help them.
Yo creo que es importante
I think that
que todas las personas accedan a
anyone
el
should
servicio y
access
accedan a la
this
información sobre la
service,
interrupción
and
oportuna del
anyone should
embarazo, no
access
importa su edad,
information
porque entonces
on
recaeríamos en esta
abortion, no
visión
matter their
de
age,
adultocentrismo
because
y de
if
que los
not,
jóvenes no saben qué hacer con su cuerpo cuando sí saben y sí tienen
we
el
will
poder de
see
decidir lo que quieren para su
youth
futuro y
oppressed by
su cuerpo.
adult centrism, and youth should also be able to decide for their own body.
All right. Thank you so much, Esther. And thank you once again to our panelists. Unfortunately, like all good things, we are at the end of the webinar, and I know we've not been able to answer all the questions. So we will be working internally to try and compile some answers to the questions, but you may also reach out to us for any follow-up questions or for specific linkages to the speakers that we've had on board today. We are very keen on, keeping the conversation going. So we will be sure to facilitate that. If possible, we will also have another iteration of this incredible discussion, just so that we can keep these perspectives flowing amongst each other, so that we can keep learning from each other. It's been truly an honor to, just listen in to everybody's perspectives today. So before we close out for the day, we will be taking one final poll. And then after that, we'll listen to a closeout from my colleague, Ramon. So over to the tech team for the poll, please. I will also be reading it out loud so that our interpreters can translate. So we will be using Mentimeter. You may have noticed a tiny dialog box pop up on the right of your screen from Mentimeter. So please open it up and answer the question on the side. It should be a very short question, also loading on my end. I will be reading it out loud shortly. So the question for the day as we close this out is, what is your biggest takeaway from today's conversation? Once again, what is your biggest takeaway from today's conversation? Feel free to also answer the question in whatever language you're most comfortable with. And I'm keen to read out any exciting answers that we may have today. Okay. Feel free to keep the answers as short as possible or as long as possible within the limits that we have. Our tech team will be presenting whatever answers we may have shortly. Okay, we may need the tech team to switch the screen that is visible so that we're able to see the answers that we have today. Okay, we do also have somebody on the team, on the chat, asking for us to reshare the question again. You can also put in your answers in the chat. Okay. In the meantime, once again, I would like to thank every one of you for making the time to join us today. It has been my honor to moderate this discussion and to hear from all of you from all over the world. Your insights are truly incredible, and we ultimately hope that they will be used to shape the self-care landscape. So as we wait for the tech issue to be resolved, I will allow me to hand over very quickly to Ramon to share a final quick reflection for 2 minutes. Over to you, Ramon.
Okay, thank you very much, B. So thank you very much for helping to manage the whole section. So to me, Hope you can hear me now. Can you hear me? Hello?
Yes. Yes, we can hear you.
Okay, great. Okay, great. So thank you very much, B. So firstly, I would like to commend and appreciate all our panelists for sharing their thought on this important topic. To me, it looks like we should just continue, but very unfortunate that we just have to close it for today. So probably maybe we are still going to have a follow-up course so that we can have more time to actually deep in more of some of these important questions and important issues raised by the panelists. But more importantly, that I would also like us to also understand is the fact that self-care itself is a tool that can help us to achieve the global healthcare coverage. There's nothing that we can do. So government across the world does not have the manpower, does not have all the resources that is required for them to provide the healthcare system that we actually need. This is not limited to maybe low income country or high income countries. So, for every country, you see that there's always a gaps in the healthcare system. But the only thing that can help to bridge the gap is just the self-care. And I believe that we all see what happened during the COVID too, that, the important role that, the self-care can actually play. So, and the team cannot do it alone. So everybody on this school also have important roles to play, not just only the leadership of the SCTG. So all of us have important roles to play. So how can we amplify this important issues, topic? How can we just some of the things that we've also learned? How can we inculcate that into our various programs, into our organization, policy? Let's have some policy within our organization on self-care. How do you want to ensure that every groups also be included in whatsoever government is doing? Just like Sharon actually said during our own presentation that we don't have sign interpreter. So I agree with her. So, but we can still do more better. So moving forward, so some of the things that me even personally have also learned that diversity we continue to at every point in time we also see that. But whenever that we see that there's a group that is lacking behind, we must provide a solution on how to bring them on board so that they can also benefit from this. But more importantly, I want to appreciate everyone for taking their time to to attend this meeting, important meeting. And I believe that we are also going to join for the follow-up call. Thank you all. Thank you. Over to you back, B. Thank you.
All right. Thank you so much, Ramon, for your input. As we close off this webinar, I would like to hand the mic back over to Kim to close us out. But it has been, once again, it has been an honor. It's been exciting to moderate this discussion, and I do hope to keep the conversation going in other spaces. And I do hope that the rest of you also will in the various spaces that you're working with in. Over to you, Kim.
Thank you. Thank you so much, B. Thank you so much to our fabulous speakers today, our interpretation team that was working hard behind the scenes. This was a really inspiring and motivating conversation with some great examples of practical things we can do as a community to uplift voices of young people and really engage youth as partners in advocacy for self-care. Lots of vibrant, talk in the chat. I love to see people making connections amongst their work. So let's keep that conversation going. We're already over time, so thank you for hanging on a few more minutes longer, but we hope to have another discussion like this again. Please feel free to reach out to any one of us if you have questions or want to connect, and join us at the Self-Care Trailblazer group if you're not already a member. So please enjoy your afternoon, your evening. Have a great day. And let's continue pushing the self-care movement for young people and all people forward together. All right. Thanks, everyone. Have a wonderful rest of your day.
You too.
Bye-bye.
Bye.
Thank you.
Bye. Thank you. Bye.